Hello, everyone. This is Dave Iverson, contributing editor at the Michael J. Fox Foundation and the moderator for our continuing series of webinars on the latest in Parkinson's disease research and what it means to live with Parkinson's, our continuing Third Thursday series of webinars. Thanks so much for being part of our discussion today. We have a really interesting topic, I think, and that's young onset Parkinson's, what we know about it, and what it's like to contend with that particular version of Parkinson's disease. On the screen now, you see just a list of tips and things that we put forward. We know sometimes there are technical issues in all of our lives, and so here are a few suggestions for if any of these things pop up during the course of our discussion today. We also want to remind you, as always, that you'll be able to submit your questions through the hour. There's the Q&A box near the middle of the screen, and you can type your questions in there, and as always, we'll try to do our best to get to as many of those questions as we can. And then last quick point before we get started, all of these slides are available for download as well as our resource list, which I think particularly today, there's some handy resources that you may want to download and save. So you can just click on the link there, and then that document will open in a new browser screen, and you'll be able to save or print that document from there. So let's go ahead and talk about what we're going to cover on today's webinar. And we're going to talk some about what we know and what we don't know yet about young-onset Parkinson's disease, what distinguishes it from other versions of Parkinson's. We'll talk some about the various treatment considerations when you have young-onset Parkinson's, what's different and what isn't different about those treatment possibilities, as well as the kinds of things that people have found useful in contending with it, from exercise to participating in various activities. And then we'll spend a lot of time, I think, also talking about how young onset in particular affects various aspects of life, both personal and family life, as well as career and social life. So let me introduce the people who will be joining us today. Nancy Mulhern is joining us. Nancy was diagnosed 11 years ago when she was at the age of 44. Nancy, thanks so much for being part of our conversation today.
You're welcome. My pleasure.
Really great to be able to speak with you again. Joining us too is Dr. Rachel Dolan. Rachel is the Vice President for Medical Communications at the Foundation and is also a movement disorder specialist who saw patients as a clinician when she was working as a movement disorder specialist in North Carolina. Rachel Dolan, thanks as always. Great to have your expertise and contribution.
Glad to be here.
And Eric will be joining us too. Eric, I don't know if you're with us. Say so if you are. Okay, not quite yet. Eric is another young onset person who was diagnosed a few years ago at the age of 42, and hopefully he'll be able to take part in our conversation. All right. I'm going to ask Dr. Dolan to sort of give us kind of the big picture before we hear more from Nancy and later Eric's specific experience. And these are some of the things that we think are what we know about what distinguishes young onset from other aspects or other versions, rather, of Parkinson's disease. And you see them on the screen, both in terms of the journey to diagnosis, as well as some specific symptoms that are a bit different, slower overall progression, and so forth. But Rachel, you know, one of the questions that's come up, and people have already emailed this in, is this sort of general question about whether or not young onset is qualitatively different than other versions of Parkinson's in terms of whether it progresses faster, whether you're more prone to certain symptoms, whether if you have young onset, you kind of always have young onset, and that's distinctive than other kinds of Parkinson's. So just give us a bit of a big picture, if you would, about what we know that distinguishes, if it does, young onset from other kinds of the Parkinson's experience.
Young-onset Parkinson's disease is basically defined by a diagnosis of Parkinson's at age 50 or before. So the average age of diagnosis for Parkinson's is around 60 or later. So about 10% of people are diagnosed with Parkinson's around age 50 or earlier. And people with Parkinson's who are diagnosed with young onset have basically the same symptoms. They are treated with the same medications, and they have, in general, the same course. But as you see on the screen, there are a couple of different caveats that are different. So they can be more prone to dystonia, which is an involuntary muscle spasm or a muscle contraction that can cause the body, a body part to contract and be in an abnormal position, so cause like inward turning of a foot that can be painful. They can be more prone to dyskinesia, which are abnormal involuntary movements. We'll get into those in a little bit that can be caused by medications. But they're less likely to have other symptoms like balance problems or dementia, memory, or thinking problems later on down the line. They also have, in general, kind of a slower overall progression of disease. So again, there are kind of the same symptoms that they may be more prone to, but some are a little bit different. Again, medications are all the same whether you're diagnosed with Parkinson's earlier on or later on in life, but the approaches to treatments may be a little bit different. The diagnosis is made the same. We don't have an objective measure for diagnosis, whether you're diagnosed earlier or later on in life. It's based on your medical history and your examination. But people who are younger might not be expecting to have Parkinson's. Their doctors might not be expecting them to have Parkinson's. So they may take a little bit longer to get the diagnosis. Tremor may be attributed to other things. Other symptoms may be attributed to, sports injuries or other things, and it may take them a little bit longer to get a diagnosis. And as with people who are, again, later on in life and are diagnosed with Parkinson's, researchers think that most of the cases are a mixture of genetic and environmental factors. But when people are particularly young, maybe even younger, 30s, 40s, and they're diagnosed with Parkinson's, there may be even more of a genetic predisposition for Parkinson's. So as we're learning more about genetics, we're finding out more of the genetic mutations that cause or increase risk for Parkinson's, and in those cases, we may think that genetics play more of a role for causing the disease.
Rachel, I think that's a really useful big picture overview of what is distinguishing about young onset Parkinson's, but also what it shares with the more standard versions of Parkinson's that usually appear later in life. One question that's coming up already that people are emailing in and calling in with that I want to get to right away. We'll talk about this in a little bit more detail later, but I think one of the big questions that everyone's asking, and we'll hear from Nancy Mulhern on this question in just a moment too, is the benefits of starting levodopa therapy right away versus delaying it. The concern is if you start it early, while it may be helpful, then you're on it for that much longer, and it may make you more prone to what you mentioned a moment ago, dyskinesia, later on the disease course. So can you just comment on that briefly now, since so many people are asking about it, Rachel, and then we'll talk about it in a little more detail later.
That's such a common question and such a common concern. So to back up a little bit, levodopa is a medication that's very commonly used in Parkinson's disease. It's basically what we call the gold standard of treatment because it works very well for a lot of people with Parkinson's. It's basically a temporary replacement for dopamine, which is the brain chemical that's lost in Parkinson's disease. And what the concern is that with long-term use of this medication combined with sort of long-term Parkinson's disease, it can contribute to a complication called dyskinesia, which is an abnormal involuntary movement that can look like different things in different people. It can be writhing, wriggling, fidgeting, body swaying, head bobbing, all kinds of things. And it's different degrees in different people. Some people it's bothersome, painful, interferes with daily activities. Other people say, I'd rather have dyskinesia and be able to move rather than be rigid and unable to move with my Parkinson's. So again, it's sort of a complication of long-term use of levodopa. It's more common in younger people with Parkinson's disease, which is why it commonly comes up with younger onset Parkinson's disease. So there comes this question of, if I have younger onset Parkinson's, should I delay taking levodopa? There are other medications for Parkinson's disease, so oftentimes people will go to those medications first, or they will delay taking medication because their symptoms aren't very significant and they can delay taking medications. They can use other things like exercise or other therapies to treat their symptoms. So it's really sort of a risk versus benefit question for you and your individual situation, which you have to really discuss with your personal provider and determine how significant are your symptoms. Are they interfering with your ability to work, to exercise, to have your social life, and are they interfering with your quality of life? And if your symptoms are to that point, do they need treatment? Can the treatment be addressed with other Parkinson's medications, or do they need to be addressed with levodopa? And so that's sort of the conversation that you need to work through with your doctor and come to a conclusion, again, that works for you and for your situation.
Let's bring Nancy Mulhern into our conversation at this point and begin to get a first-person personal view of contending with young-onset Parkinson's, including this question that Rachel was just giving us such a good briefing on in terms of the various questions that you have to sort through as far as when to start taking medication. Before I ask you, Nancy, specifically about what happened with you and your decision when to start levodopa, carbidopa, give those of us, everyone participating today, a sense of your own journey with this. You were a young person, early 40s, when you first noticed that something was not quite right. Can you describe what you first noticed, and then we'll talk a little bit about how this experience affected you.
Sure. The first thing I noticed, I remember very clearly. I went for a jog in my neighborhood. A neighbor drove by, and I went to wave to him. And I noticed that my pinky finger wouldn't bend. It wasn't doing what I wanted it to do. And I didn't really think too much of it. I thought maybe carpal tunnel or whatever. But I noticed that a few weeks later, I woke up and I had a tremor in my hand, which progressively got worse. So I knew it was time to visit the doctor at that point.
And then fairly quickly, you saw both a neurologist and subsequently a movement disorder specialist who then confirmed that what you were contending with was indeed young onset Parkinson's. Can you describe something about what your reaction was at that point? Because while, of course, getting a Parkinson's diagnosis is never welcome in anyone's life, there are obviously some particular challenges when you get that 20 years earlier than would be the average.
Well, it was complete disbelief, first of all. I didn't have anybody in my family that had Parkinson's, and I just, for the life of me, couldn't figure out why this was happening to me. It was very scary. I went into denial. I kept it a secret. I didn't want anybody to pity me or stare at me to see if I was shaking. I didn't want it to define me, and I kind of, I almost tried to pretend it just wasn't there. But after a while, that doesn't work.
And our colleague on this call, Eric, who's also a young onset individual, is delayed by way of some travel issues, so we'll hope we'll get his perspective soon. But in your conversations over time, Nancy, with other people who have received this diagnosis at a young age, has that been a common experience, this feeling of this can't possibly be happening to me and I'm just not going to accept it, I'm just not going to have it be part of my life?
Yeah. That's extremely common, and I wish I hadn't realized it was extremely common when I experienced it myself. I knew nobody that was young that had Parkinson's. I only knew of older people that had it, so I felt like there was nobody to turn to. It's just a very scary position to find yourself in because the future is so unclear, and there's so many unanswered questions In time, I'm doing much better, but that moment when you're diagnosed with Parkinson's, especially young-onset Parkinson's, is probably the worst moment that you will experience with Parkinson's.
And I think, Dave, if I could...
Go ahead, Rachel.
Dave, yeah, I was going to jump in and say, I think something I've heard as well, and Nancy, you can share a little bit more about this too, is that people who have young-onset Parkinson's often feel alone or frustrated or fearful because oftentimes they feel like they don't fit in, or they can't find the right support group, or they feel fearful because they see people who maybe are more advanced or older or have different symptoms and worry that that's the necessary and natural progression of their Parkinson's. And they say, oh no, I'm going to be, in need of a walker, or I'm going to have a wheelchair, and, or there's nobody else who's my age and has this disease. So it can be a very scary situation to be in, being young and having Parkinson's and feeling like this is an older person's disease.
And indeed, I know, Nancy, for you, that actually visiting a support group, as you did early on, actually compounded some of the difficulties you had in coming to terms with Parkinson's. Tell us a little bit more about that experience.
It definitely did, and Rachel is so right on. When I was living with my Parkinson's in denial, I knew after time I had to get support someplace. So I did research where to go to try to find that. I went to some local support groups, and I felt that made my situation even worse because it was so overwhelming to walk into a room and see people so much older than myself in wheelchairs, and I was surrounded by pamphlets on assisted living facilities, and it was very, very scary. And I did try, though, for 3 times, and I didn't know where to turn. So I kept looking, and then I discovered a seminar that was being held by the Michael J. Fox Foundation in New York City. So I said, all right, I'm going to give this a try. I went by myself because I didn't want to be a burden to anybody. I didn't want to make my Parkinson's part of anybody else's world, I guess you could say. So again, I walked into this room, and it was, I almost sat down, but I said, you know what, this is looking better than any other support group, but I just still can't do it, until a staff member spotted me and asked if she could help me, and I told her I just don't think I can do this. And she was so wonderful. I call her my angel in disguise because she led me to a table with other young people that had Parkinson's, and she sat me next to Sonia Mather, who was diagnosed with Parkinson's, young-onset Parkinson's, a few years earlier than me, and my life changed, thank goodness, by that encounter. And I realized I was not alone, and it was just so wonderful to realize that finally, and then I just took off from there.
It's such a great story and such a reminder that all of us need in some way, at some point, when we're ready, and that varies, I think, for all of us, to make that connection.
Oh, you know what, Dave?
I'm
sorry, Dave, but there's one other point about that meeting that sometimes I forget to say, but it's so ironic. During that afternoon, I heard a voice from behind me say, hey, Nance, you have PD? And I turned around, and it was a guy that I had graduated from high school with, who was at that very same event. So how crazy is that?
Yeah.
So you're not alone. You just have to go out there and find. You will find help, but don't hide in a corner.
Yeah, it's such a, I think, telling point, and that you were persistent and did make those connections, and those in turn have made all the difference. Probably many people participating in this webinar today know the name Sonia Mather. She was on the Michael J. Fox Foundation Patient Council and moderates some of our other webinars for the Parkinson's and Parkinson's Project. Just an extraordinary person. You couldn't have landed next to a better
So true.
And I'm
so true.
It's it's a great
And
testimony.
I've met so many people like her. It's just incredible, the motivational, inspirational people that are out there that are living with young-onset Parkinson's disease and doing all things that they have to do to stay well. And I'd be lost without them. I really would.
Yeah, exactly. Well, let's begin talking about some of the treatment aspects and some of the things you can do to contend with young-onset Parkinson's, and we'll start adding in some of the questions that are coming from our participants today. And we see at the top here these considerations about starting levodopa and when to do that Rachel Dolan was walking us through a bit earlier. But Nancy, why don't you continue a bit with your experience with that? Because I think, again, it's very common that we have those considerations, that people have those considerations, and I think you wrestled with that as well. So describe kind of your own journey when it came to the decision to when to first start taking that medication.
Well, that's a very, very difficult decision. It's almost like you're giving into your Parkinson's, and it was honestly the only time I've ever cried at any doctor's appointment is when the doctor said, I think it's time for levodopa. It was just a terrible feeling, but my biggest symptom is rigidity. So when it came to the point that I felt that my rigidity was so bad that it was affecting the quality of my life, I gave it a try, and I was so glad I did, because it really does work temporarily, obviously, but it made the quality of my life much improved. And I realized that I was doing what I had to make each day as productive as I could by taking it. So I would say, yeah, go for it.
I think one question that's relevant, whatever form of Parkinson's you have, and it's one my own neurologist always asks me, which is basically, how are you doing? Are you able to do what you want to do? And if you are, then we don't necessarily need to change anything. But if you aren't able to do something that you want to do, then it's worth examining, an adjustment in medication. And it sounds like that decision did then allow you to be able to do more of what you wanted to do. Rachel Dolan, let me ask you for, I think see if you can help us make an important distinction, which is, as you noted earlier, if you start taking levodopa earlier on, and many people with Parkinson's, since they're diagnosed much later, the one risk we know that takes place is that later in the disease course, you may be at more risk for dyskinesia because of that long-term levodopa use. That said, it doesn't mean, from what I understand at least, that levodopa quits working after a while, as far as, it's not like you only have a certain amount of levodopa you can use, and then you won't be able to get its benefits. Sometimes people delay taking it because they think, well, I want to save it for when I really need it. But that's really not so much the case. The reason it may work less well later on in the disease is because your Parkinson's is that much worse. It's not like there's a statute of limitations on how long you can use levodopa. Is that right? Can you help us clarify that distinction?
Yeah, you put it very well, and that's exactly right. And I often, it sort of pains me to hear when people are saving levodopa or medication as sort of their trump card for later on, when I see them kind of suffering now and their quality of life suffering now and getting in the way of them doing what they want and need to do now. So that's often my question for people, as you pointed out, Dave, is, are your symptoms getting in the way of what you want or need to do now? So is your tremor bothering you to the point where you're not going out to dinner with your friends? Or is your stiffness getting in the way of you exercising, which is so important for Parkinson's? And if so, is any symptom getting in the way of your quality of life? And if yes to any of those questions, then we need to treat it. And maybe it's not with levodopa, maybe it's with another medication, but then we need to work in partnership to treat your symptoms. And it's a partnership. It's together with your doctor, but we need to work to find some good medication or therapy regimen to treat your symptoms. And so, whatever it is, levodopa or another medication, but we need to work to find a good regimen to treat your symptoms and get you a good quality of life, get you exercising, get you doing what you want and need to do. So again, as you pointed out, Dave, it's using levodopa. To get back to your original question, levodopa does not need to be saved necessarily, because it's not that it stops working later in the course of disease. It's that the natural progression of Parkinson's is to, over time, gradually worsen. So you may need gradually increasing dosages or to take a little bit more throughout the day. So it may seem that it's not working as well over time, but it's not that you need to kind of save it for later on in the disease course when you might feel like you need it more.
Rachel, let's take up, before we get to exercise, which I know Nancy has some really useful thoughts on. But before we get to exercise, a number of other questions have come up about treatment, and I want to see if we can work our way through a couple of these. A number of people, Rachel, have raised the question of DBS as it relates to young onset. We used to think of DBS, deep brain stimulation, as being a treatment sort of reserved for later in the disease, when other treatments were not working as effectively. But there's been some indications, some research, some thought recently that DBS may be, because it can work so well for certain symptoms like tremor, could be done earlier on in the disease. And so I think it's a very useful and important question that people are raising here. What about DBS and when you're younger? What's the latest thinking from the movement disorder specialist community about that possibility?
Right now, deep brain stimulation is indicated for people who've had Parkinson's for at least 4 years. So you've had a diagnosis of Parkinson's for at least 4 years, and you have a response to medication, so your symptoms improve with levodopa or other medications. One exception to that rule is tremor. So if your tremor doesn't improve with medications, it may still respond to deep brain stimulation. And you have complications from the medication. So this is where that dyskinesia comes in, or you have prolonged off time, so you are not, your symptoms are not well controlled with medication throughout the day. And so it is typically used in the middle to maybe the more advancing stages of Parkinson's disease right now. There is a lot of ongoing research to see if it could potentially be used in earlier stages of Parkinson's disease. There is a trial that is FDA approved and is anticipated for next year to evaluate deep brain stimulation in very early Parkinson's disease. So that would be people who've been diagnosed anywhere from 6 months to 4 years. But that doesn't necessarily differentiate between people who are young onset or, average age of onset of Parkinson's disease. That just differentiates between people who are, diagnosed at different ranges. So there again, the differentiation for deep brain stimulation doesn't necessarily qualify for people who are young onset versus average age of onset. This is looking at people who are at different stages of Parkinson's disease.
I see. So the key factor is at least at present, is how long you've had Parkinson's, not necessarily the age you were at diagnosis. We want to welcome Eric into our conversation, who is also someone who was diagnosed with young onset at an early age. Eric was in his early 40s when he was diagnosed half a dozen years ago. Eric, thanks for being part of our conversation today.
Thank you. I'm glad to be here.
Glad to have you. And Eric, as you may have seen on the introductory slides, is asked not to use his last name for reasons that relate to some of this conversation that we're going to get into a bit, and that has to do with how you're viewed in the workplace. And so we particularly want to get Eric's thoughts on that question in just a little bit. But Eric, where you're joining us in the webinar at this point is we're just talking about differences in treatment when you have young onset, and the point we were just about to get to that I'd like to hear from you and Nancy on further is exercise. I know that's something that's been you've found particularly useful to you. Could you describe a little bit about what you've done with exercise and the way in which you found that helpful in contending with young onset Parkinson's?
Certainly, I'd be happy to. It's definitely a key component of my treatment program, and I do a combination of strength training, biking, and boxing. The effects are kind of interesting for me. While I'm exercising and right immediately after I'm exercising, my tremors actually increase. However, when I'm not exercising, an hour later or, probably the next day or what have you, my symptoms are significantly improved. And so for me, it's doing the high intensity work in all those areas and making sure I allot time and as well as sleep so I can manage and perform well during those times of exercise. I also try to time my medication so I'm looser. My body's looser, not quite as stiff when I actually do engage. So I'm actually working the muscles appropriately.
So interesting. So initially, after you exercise, there's a short period of time where your symptoms are actually a little bit more exaggerated, but then subsequently, you feel like there's a pretty specific benefit to how you do in the next day or so following an intensive workout compared to a day when you don't work out. Is that right?
Yes, it's not quite that immediate, but it's more in the sense that it's more of a gradual decline in benefit, or another way to say it is a gradual increase in symptom activity the longer I go without it. So if I go 2 weeks and I'm only able to exercise a few times because my schedule demands it, then my symptoms are more noticeable. But then after I start exercising for a week and I get back onto my regimen, then over the course of a week or two, my symptoms settle down.
Got it. And Nancy, let's bring you back into the conversation at this point and describe how exercise has been useful for you.
I would have to say exercise is the number one most important thing that you can do to manage your Parkinson's. For me, my situation I think is a little different than Eric's, because when I exercise, I feel like it's at times I feel like I don't even have Parkinson's. Once I get going with a good workout, it feels like my symptoms go away at that point. Now, it takes me a while to get going exercising, but once I get into the swing of it, it makes me feel healthy. And not only physically, but emotionally. It's very good for my positive, it helps me to stay positive. And I think, the mental affects the physical and vice versa. So I would be lost without exercise.
And Rachel Dolan, from a medical point of view, first, it's not surprising because as with everything with Parkinson's, one's reactions to it differ. So probably not surprising that Eric and Nancy have slightly different experiences of the benefits of exercise. So both feel it's really key. And this seems to be a universal now, and I think it's fair to say that this is increasingly recognized by people in your community, in the movement disorder community, at how important exercise is. Would you say, Rachel, that it has even more, perhaps, importance for someone who is young, just because the amount of time that they're going to contend with this disease is that much longer? So staying fit, perhaps, is even of greater importance?
Yeah, we think exercise really is critical for everyone with Parkinson's disease. I mean, really, no matter your age at diagnosis. But younger people generally are more fit, don't have as many medical problems, and so therefore can more easily exercise more regularly. As Nancy and Eric have sort of illustrated, all forms of exercise are beneficial. The most beneficial exercise is the one you'll do regularly. No one form of exercise has been proven more beneficial than another for Parkinson's. So it's sort of pick the exercise that you'll do, that you enjoy, that you feel safe doing, and stick with it. There are some forms of exercise that have been proven a little bit more beneficial for specific symptoms. So, if you have balance problems, you may pick, yoga or Tai Chi or dance, for example. But really, it's just important to exercise and exercise regularly. And as Nancy pointed out, it's important for both the motor and the non-motor symptoms. So it can help with mood. Even though it's counterintuitive, it can help with fatigue and sleep problems. It can also help with constipation. So it really is, if we could write prescriptions for it, we would do it. It's just as important as the medications you take.
Well put. Let's explore now some other aspects of living with young onset Parkinson's and the way in which that affects both family life, social life, and career life. We have a lovely picture on the screen of Nancy and her two young adult children, and also some guides that Rachel has worked on that are available in our resource list if you want to download it, about contending with Parkinson's in the workplace. Let's explore that second point first, actually, because it's part of why we were so appreciative, Eric, of your being willing to participate in the webinar today, because it's been a concern for you about how you manage Parkinson's in the workplace. Tell us a little about what you're comfortable with as far as describing what your experience is in and your reluctance to be public about this, which is, I think, again, a very, very common experience. So your take on that first, Eric, and then we'll explore it a little more broadly and respond to some questions that people have been sending in about dealing with Parkinson's at work. Eric?
Certainly. So career is important to me, or I've placed it as a high priority for me because of my age and the fact that I don't have a family, so I'm the only bread earner. And I'm just, as I think about the future complications and just not just from Parkinson's, but just future needs of life. And so if at some point I do become unable to hold down a position, I want to make sure that I have adequate financial resources to carry me through the rest of my life. And so that's one reason why I put an importance on it, and I'm a little sensitive to it. Having said that, I fortunately or unfortunately come from a family of lawyers and HR representatives, and so they've instilled in me a certain fear, if you will, of employment discrimination and being picked out of the crowd due to any particular type of issue. But of course, here we're talking about Parkinson's, and so that's driven a lot of my reluctance to disclose my PD to my coworkers. And so there's a lot of energy going into that from a focus perspective. And the little secret is everyone kind of already knows I have it anyway, or they know I have something because my symptoms are visible. And so it's a little bit of a mental game for me, and something I wrestle with on a weekly basis. Should I disclose it or should I not disclose it? It certainly seems it would be a lot easier sometimes if I would. But I don't necessarily see the upside for doing it. It's not being as great as the downside.
Well, first, Eric, thank you for your candor in talking about, I think, what is a really difficult issue and the way in which you are working your way through that. I think it's really admirable, and particularly admirable in a way that you would choose to participate in this webinar to talk about something that's very difficult to talk about. So thank you again for your participation.
I'm actually in a conference room at my work right now.
Well, you know, I think it's also worth noting that you do a number of other things to stay connected to people. You lead a spinning class for people, and so you find ways to participate like you are today. It's not like you're sort of walling yourself off from every aspect of living with Parkinson's.
No, I'm actively engaged, as you just described, both with a number of organizations here in Colorado, and it's something that is very dear to me, and something that I want to continue to figure out how I'm going to involve and progress all the energy and resources towards finding a cure more and more as I move on with my life and then move on to dealing with Parkinson's. One quick note I'd just like to add about work is that for me, it really depends on the environment where you work and how much you trust the people that you work with. So I had an experience where I disclosed my condition to some coworkers after I had left a particular company a couple of years ago. And they basically said they knew I had it or knew something was definitely wrong. And it was really interesting because the comment from this person was, we were all just concerned about you and wanted to help and support you, but we knew you didn't necessarily want to do that. So in hindsight, I missed out on a lot of support structure for not disclosing it. And I don't know if anything negative would have happened in that situation if I had, but certainly you develop a lot of friends and personal relationships at your workplace, and that was certainly something that I missed out on with my decision to keep it quiet. Having said that, I'm doing that again at my new place of work, so we'll see how it goes.
Yeah, well, again, thank you for being so candid about your experience, and I think that does bring up a useful, not counterpoint, but you know, an additional experience that perhaps, Nancy, you can comment on, because I know you struggled with that initially at work too, and found in the end that your coworkers, you know, really did want to be supportive. How did you work your way through that same dilemma that we've heard Eric so eloquently describe?
Well, I can relate because my coworkers knew something was wrong with me before I thought they knew. You know, I guess I was thinking that I was concealing my symptoms, but in actuality, I wasn't. I remember one time I was putting on lipstick, and my coworker said to me, "Nancy, why is your hand shaking like that?" And I didn't realize my hand was shaking. So they notice things. You're around your coworkers almost, in some instances, more than you're around your family. So they pick up on things. And when I finally did tell them, they weren't surprised. They just wanted to help. And they were very supportive. And they were concerned, but I made them feel comfortable, and I did my work the best I could. And they were very, very helpful, actually, more than I thought they would be. So it was, I was fortunate to work around a very caring group of people.
And I think, as you've observed, and Eric did too, as far as the reactions of his former coworkers at his previous company, oftentimes if you give people the chance, they want to be helpful, they want to be supportive, and it winds up being an opportunity actually to form connections and to gain something that you might not otherwise. But it's tough, and like all things with Parkinson's, it's very personal, and I think everyone has to come to these things at their own moments in time. Rachel Dolan, I'm going to ask you just for a quick, if you would please, additional observation about this as it relates to the guides that we see on the screen and other resources, because I suspect this is something that people are going to want to think about, read up on. Any additional suggestions you want to make about dealing with a Parkinson's diagnosis in the workplace?
Yeah, I mean, Nancy and Eric both, said it so well with their personal stories, and you summarized it so well. Just like everything else with Parkinson's, it's such an individualized thing, and it's, it's going to be based on your situation, your symptoms, your approach, your workplace, your job, how you feel about your coworkers, your boss, your reputation there. I would say that, what I've heard from so many people, though, is that, gosh, I didn't realize, like Nancy said, my symptoms were so visible, and other people were kind of making up their own ideas and stories about what my symptoms were, especially with younger people. They thought my tremors were anxiety, or I was nervous about giving my presentation, or when I was taking my medication, I was popping pills, or, because my balance was a little bit off, I was, intoxicated, or whatever it was, because again, people aren't expecting younger people to have Parkinson's disease or any disease. So there can be that, stigma or misconception associated with Parkinson's disease, and people want to, explain things away when they see things they don't understand. So, like Nancy said, there can be a lot that can go into, thinking that people don't see your symptoms. And I'll just mention, because the guides are up on the screen, there are 2 guides that I wrote in conjunction with a career consultant. That one is on kind of sharing your diagnosis in the workplace, and the other is on kind of continuing the conversation in the workplace. And they're both really sort of practical guides that are step-by-step advice on how to do those things.
Thank you. And we should also mention that also on the Michael J. Fox Foundation website, there's an additional blog post about some of the issues Eric was talking about. What are the risks and benefits of talking about it, and some of those sort of more employment discrimination sort of issues. So you can look for that on the Fox Foundation website. Also on the National Parkinson's Foundation, now known as the Parkinson's Foundation website, there's some additional material about contending with a Parkinson's diagnosis in the workplace. So some additional resources. Let's switch gears a little bit and talk more about the other aspect of what we see on the screen. We see Nancy with her 2 kids. Eric was talking about how things are a little different when you're a single individual. Let's talk a little bit more about some of the personal aspects of young onset, and as our conversation here continues. Nancy, I know in an earlier conversation that you and I had, you mentioned that initially you told your husband and not anybody else, including your kids or co-workers. Can you describe a little bit about the kind of arc of your personal experience? What was difficult early on, but in time, how that then began to be something that as a family wound up bringing certain aspects of your life, I think, that much closer together?
Well, when you have a Parkinson's diagnosis and you try to keep it a secret, it's difficult to keep it a secret. It's difficult to tell people. So I came to the point where I knew my kids needed to know, and the rest of my family. So I sat them down at the kitchen table and I explained to them what I had, and they didn't really say anything. I think they were just very unsure of what the future was going to hold. And then as time went on, they realized that I'm still mom. I'm not making Parkinson's a huge part of our life. Sure, I'll have limitations, but it's not going to define me. And it was a slow process. I started to get involved with Fox events and other Parkinson's-related events to try to work towards a cure, and they didn't jump right on board right away. They were afraid, I think, but they were 14 and 17 at the time. And as time went on, they kind of wrapped themselves around the realization that it was going to be okay, that this is something that we could deal with as a family, and they started to get involved. And 2 years ago, my son cycled with me in California at a Tour de Fox event, and this year my daughter will run in the New York City Marathon with Team Fox. So I'm so proud of them, and they have found they found support for themselves too through other children of people that have Parkinson's also, because they need support too, and they need to know that they're not alone as well. So it's it's been a long journey, but we're at a good point now. We're at a point where we can deal with it.
Yeah, and it sounds like you've each helped each other deal with things. And
exactly.
Exactly. Two young individuals next to you in that photo. Eric, I know for you the challenges have been different as someone who's single. And I'm sure there are other people listening and participating in our webinar today who are wondering about that, or who may be in that same circumstance. Tell us something about how you worked your way through how having young onset has affected you personally.
Yeah, so for me it was just different than Nancy, obviously, as you pointed out, just from a support structure perspective. So without the family circle in my immediate vicinity, I really relied on friends and my family to some extent as well. But not only do I not have my immediate family myself, but my mother, father, sister, brother, and their respective families are not in state either. So I'm alone in the state as well from a family perspective. So I've really been relying on my friends, and three in particular. And it's been difficult because even as they're very helpful and very dedicated and love me dearly and do anything for me, there's still those times when I have some lonely and a little bit of depression. Nothing that requires medication, mind you, but certainly I feel that loneliness, and those Sunday afternoons and Sunday nights, or those nights when I get home and I'm alone and I'm feeling a little emotional. It's a little bit different to grapple with, and it takes a little bit more energy for me anyway to tackle that and address those issues alone by myself. So what I've tried to do is I've tried to expand out the people that I can address and talk to, because after like 3 years, I felt like my three immediate friends that were my main support structure were probably getting a little bit tired of listening to me talk about things again and over and over and over again. So I tried to spread that out and talk more to my family about it and disclose things to more people. I'm active in the Young-Onset group here and in Colorado, and so I've tried to diffuse that uniqueness of my situation of being single with spreading out and broadening my support outreach group.
Well, it sounds to me like you're a guy who keeps working at things and keeps working your way through things, whether that's teaching a spinning class or expanding your circle. And I think it's very helpful to hear the way in which you're contending with that, Eric. I'm going to put up on the screen now just kind of an overall list of some thoughts we have on this topic as we use our last 7 or 8 minutes here to take a variety of questions that have come up over the course of the hour. And so we'll just leave these on the screen and take your questions, and we'll try to work through these as quickly as we can, since we just have a short amount of time remaining. But here's the first question for you, Eric, which is someone asked if you could comment on dating when you have young onset Parkinson's.
Yes, it's been a challenge. I dated a woman for 3 years after my diagnosis, and it was kind of interesting. It was a unique relationship, and it was something where we didn't really disclose a lot. So it was more of a superficial relationship, but it was genuine. But we didn't talk about things much, so it made it really easy to date someone like that. We lived together, and that didn't really press you on things. It was good and it was bad. Sure. And now we're not dating anymore, and I made the decision to not proceed with that relationship. And it was really tough because I recognized that it's something that, in my mind, when I made the decision, I came to the realization that I may not be in a relationship ever again, because asking someone to be a caregiver, not just a partner, but a caregiver that you just meet, in my mind, is going to be a tough sell. And so but it was more important for me to be with someone that was a right fit than to be with someone for the wrong reasons. And so it was a really scary time, and it continues to be a little scary for me, because not quite sure how it's gonna proceed. So I'm
Yeah.
trying my best to push myself to be out there, but it's a challenge.
Yeah, no, I can hear that. And Nancy, a question for you, if you could say a little bit more about how you juggle being a parent. This person's particularly interested in whether you have younger children and juggling parenting of younger children or teens. So you had this experience when your son and daughter were teenagers. Suggestions for someone who has teenage children on how to talk about Parkinson's, how to have that be a part of your family life in a way that everyone can benefit from, or if not benefit from, contend with, I guess, in a healthy way.
I'm sorry, Dave, I lost you. I'm not sure if you directed that question to me.
I did. I'm sorry. It was. I think I kind of meandered my way around the question, but it's really just a question. If you have suggestions for how you deal with having teenage kids, and a good way, I guess, to talk about that, contend with that when you have Parkinson's and have teenage children.
Well, that's a tough one. It depends on the kids. You have to you can't expect them to feel a way that you want them to feel. They're entitled to their own feelings. You can't pressure them to feel one way or another, and just get them in. Just reassure them, basically, is what I do, and I try to get them as involved as I can in what I participate in, and it's rewarding to help. So I think they feel good when they get involved, actually. And so they're doing that more and more.
And you're someone who's been very involved in doing a variety of things that have to help raise money to find a cure, and your kids have gotten involved in that, and that's provided an avenue. Rachel, it sounded like you wanted to add something quickly.
Yeah, I was just going to say, not having Parkinson's, I'll just share, what our community has shared, being parents of children of different ages is, using words directed at, their level of education. For teens, that's obviously, more education, but being open and honest with them, they know what's going on. So, being direct with them. I know somebody in our community shared that they found out that their mother had Parkinson's through like a letter that the mother had written. So I guess just being, more direct and honest and open with them. Maybe, kind of engaging them in ways like looking up answers to their questions together. If they're asking about like what causes Parkinson's, maybe, Googling that together on a good site. And, brainstorming for a school project around the topic of Parkinson's, or, like Nancy does, fundraising to support research, or, doing an activity like running a marathon together, or those sorts of things. But I guess the point is, kind of just, getting them involved in activities that, interest them, or, again, just being honest and open and communicating with them in a level that speaks to them.
We just have a couple of minutes left, so I'm going to have to, I'm afraid. Oh, sorry, go ahead, Eric, briefly, if you would, please.
I was going to say, to swing that around to dating, and I don't think I addressed the question very well, but to piggyback off of the last comment about being honest, I find that that's the best way. My current strategy, anyway, I don't know if it's the best way, but my current strategy is to be forthright with people, not necessarily immediately, because it might scare some people off, but very quickly in a relationship to disclose and be upfront about what's occurring with me requires less energy to hide it, and lets me be more authentic, present, and be true to who I am. And so that's the approach I'm currently taking in my dating life.
Thank you, Eric. That's a great addition. I'm going to put up on our usual ending slide now about participating in research, because it's so key. But I want to get comments from each of you as we wrap things up. And again, I'm afraid I'm going to have to ask you to be brief since we're at the end of our hour. But one thing I'd like you to address, Rachel, first, before we have a last word from Eric and Nancy. Rachel, there's been a number of questions about concerns about cognitive issues, dementia, hallucinations, things that we know are part of the experience late in the disease course. And so the question I think that people are having is, if you get the diagnosis young, does that mean that some of those issues, cognitive issues, hallucinations, and the like, will also happen to you somewhat younger, in your 60s, let's say, as opposed to in your 80s? What do we know about that and about those concerns? You mentioned earlier that actually young onset tend to have less cognitive concerns. But just give us a kind of brief synopsis of what we know in that regard, if you can.
Yep, you made the exact point I was going to make, is that that's exactly right. Dementia, memory, cognitive problems, which can be associated with hallucinations and other problems, are less likely to occur in people who have young-onset Parkinson's disease. And if those do occur, they are more likely to happen in the later stages of Parkinson's disease, which happen after many years. So those would be after, 20 years or so. So again, those are going to happen earlier in somebody with young-onset Parkinson's disease, meaning they'll happen, at age 70 if they're diagnosed around age 50.
Okay, thank you. And again, that's not, we should also note that that doesn't happen with everyone in Parkinson's. Not everyone has those challenges. So, but they do occur, and thankfully somewhat less often in people with young onset. Okay, last quick word, please, from both Eric and Nancy. Eric, to you first. Just a last thought on what you'd like to share with other people who are listening, who are also perhaps contending with having young onset Parkinson's.
Yeah, my last thought is to do what I didn't do, and that is to be more free and disclosing, and really allow yourself to be vulnerable to people, because you don't know what tomorrow brings. You kind of have today, and yesterday's already gone. So really doing what you need to do to be present in the moment and to really get the most out of life, I think, is the thought that I carry with me every day and that I meditate on.
Well put. Nancy, last thought from you, please.
Well, thanks to Michael J. Fox, I feel like the stigma of Parkinson's is dissolved. I would say don't keep your diagnosis a secret. Go out there and get engaged and do something to help find a cure, because, I'm going on almost a dozen years living with Parkinson's. It's far more difficult now to get involved than it was years ago, and I only wish I started sooner. So we need a cure, and just go out there and get involved, because that will make you feel better. And exercise, number one.
Exactly. Well, Nancy Mulhern and Eric, our great thanks to you for your participation, your candid observations, and your eloquence in talking about your experience. We really appreciate it. And Rachel Dolan, thanks as always to you for your expertise and contribution. This has been an especially thought-provoking and meaningful webinar, I think. So thank you all. And thanks to everyone for participating today. We'll be sending a link to the webinar on demand so that you can listen again or share with others. And as we wrap up, we also want to note our next Thursday webinar, which will be on Thursday, July 19th. But we're going to talk about a really interesting aspect of Parkinson's research, which is called drug repurposing. It's the idea that drugs that have already been approved for other conditions other than Parkinson's may actually have some real benefit in Parkinson's as well, may even perhaps have potential for slowing down disease progression. So that will be our topic on Thursday, July the 19th. Thanks again, everyone, for your participation. I'm Dave Iverson.
Thank you.
Thank you.